everyone, I am Jamie Lynn Becauco, your student nurse. For today's video, I'll perform a return demonstration to assess the male genitalia and rectum. But before we hop onto that video, let me show you what equipment we'll need for today's assessment. So without further ado, let's get started. So before performing this procedure, we have to perform proper hand hygiene and don our PPE if necessary. After that, we can now proceed to the assessment. Good day, sir. I am Jamie, your student nurse from Our Lady of Fatima University. So, sir, for verification, can I ask what is your name?
Cedric J. Tubat,
And when is your birthday?
November 4, 2002.
How about your age, sir?
I'm 20 years old.
So that is the first thing that we need to do. We have to identify our patient for us to ensure that it is the right patient in front of us. If there are any curtains or any doors in the room, we have to close them as well in order to provide privacy. And remember to preserve the client's modesty and make sure to always have a chaperone present in the room with you while performing the examination. So the role of the chaperone is predominantly to comfort and protect the client, but they also serve a secondary role to protect healthcare providers from false allegations. Alright, sir, before we start, I would like you to ask some questions. So, do you have pain in your penis, scrotum, testes, or groin?
None?
Do you experience difficulty urinating?
No?
Any pain while passing a bowel movement?
No?
Okay, have you ever had anal or rectal trauma or surgery? Or were you born with any congenital deformities of the anus or rectum?
None of it.
Have you had prostate surgery?
No?
How many sexual partners do you have?
Only one.
Okay, sir, thank you. Then after that, we have to explain the procedure to the patient. Okay, sir, I'm here to perform an assessment on your male genitalia and rectum. So the purpose of this examination is to detect abnormalities that may range from life-threatening diseases to painful conditions that interfere with its normal function. And if we detect any abnormalities, we will initiate early referral and treatment. Okay, sir, I will have you empty your bladder so that you will be comfortable throughout the examination. And also have you remove your underwear and put this gown. Is that okay with you, sir?
Yes?
Alright, rest assured that all of the documents are completely confidential between the attending physician and me. So, do you have any questions, sir, before we start?
None?
Okay. So, I already told the patient to change you to the patient gown. I already performed hand hygiene and provide privacy for the patient. And now, I'll be starting to perform and assess the genitalia and the rectum of the patient. So, I already washed my hands and put on my gloves. I'm going to first inspect the base of the penis right here and the pubic hair. So, I see that the pubic hair is coarser than scalp hair and that's normal. The base of the penis and the pubic hair are free of excoriation, erythema, and infestation. And the normal pubic hair pattern in adult is hair covering the intergroin area, extending to the medial thighs and up to the abdomen toward the umbilicus. Next, I'm gonna have to inspect the skin of the shaft. The skin of the penis is wrinkled and hairless, which is normal and free from the rashes, lesions, or lumps. Then I'm gonna have to palpate the shaft and note any hardened or tender areas. And the penis in a non-erect state is usually soft, flaccid, and non-tender. I'm also gonna have to inspect the foreskin. So the foreskin which covers the glands is an uncircumcised male client, should be intact and uniform in color of the penis. Then next, I'm gonna also inspect the glands. The size and shape of glands vary, appearing rounded, broad, or even pointed. The surface of his gland is normally smooth and free of lesions and redness. And if the client is not circumcised, you're gonna ask him to retract their foreskin, and if the client is unable to do so, the nurse may retract it to allow observation of the glands. I'm gonna have to also note the location of the urinary meatus on the glands right here. So it is slit-like and normally found in the center of the glands. And then I'm gonna have to palpate the urethral discharge. I'm gonna do it by gently squeezing the glands between my index finger and thumb. So urinary meatus of the client is normally free of discharge. Now we're gonna move on to the scrotum. And I'm gonna have to ask the client to hold their penis out of the way for me to observe any swelling, lumps, or bulges. And I see none. His scrotal sac hangs below or at the level of the penis, and the left side of the scrotal sac usually hangs lower than the right side, and that's normal. And then I'm gonna also have to inspect the scrotal skin. And to perform an accurate inspection, I'm gonna have to spread out the scrotal folds. And then I'm gonna lift the scrotal sac to insert the posterior skin. Alright, so his scrotal skin is thin, elongated, or wrinkled with little hair dispersion. Its color is slightly darker than penis, and it's all normal. After inspecting, I'm gonna have to palpate the scrotal contents, which are the testes and the epididymis, between my thumb and first two finger. Remember not to apply too much pressure to the testes because this will cause pain. Okay, they are smooth, firm, rubbery, mobile, free of lesions, and rather tender to pressure. So the epididymis is non-tender, smooth, and softer than the testes. Then I'm gonna have to palpate each spermatic cord and vas deferens from the epididymis to the inguinal ring. The spermatic cord and vas deferens should be uniform on both sides. And the cord is smooth, non-tender, and rope-like. If an abnormal mass or swelling was noted during the inspection and palpation of the scrotum, you'll have to perform trans-illumination, and to do that, you're gonna have to darken the room. And using your pen light, you're gonna shine a light from the back of the scrotum through the mass. And you're gonna look for a red glow. Normally, scrotal contents do not trans-illuminate. Now we're gonna move on to the inguinal. And I'm gonna have to inspect the inguinal hernia right here and the femoral hernia. I'm gonna ask the client to turn head or cough or bear down as if having a bowel movement. Alright, as the client does that, I don't see any bulges from his inguinal and femoral areas. Next, I'm gonna palpate the inguinal hernia and inguinal nodes, and to do that, I'm gonna have to ask the client to shift their weight to the left for palpation of the right inguinal canal and vice versa. Then next, I'm gonna have to palpate the femoral hernia, and to do that, I'm gonna palpate it on the front of the thigh in the femoral canal area. Then I'm gonna ask the client to bear down, so try to bear down or cough for me, sir. Alright, then I'm feeling for any bulges, and I feel none. Then I'm gonna repeat it on the opposite thigh. Next, I'm going to move on to the anus and perianal area. The first thing I'm gonna do is to spread the client's buttocks and inspect the anal opening and surrounding area. Alright, so the anal opening appears hairless, moist, and tightly closed. The skin around the anal opening is coarser than and more darkly pigmented, and the surrounding perianal area is free of redness, lumps, ulcer, lesions, and rashes. And I'm gonna ask the client to perform a Valsalva maneuver by straining or bearing down. So try to do that for me, sir. Alright, that's good. And I'm looking to the anal opening for any bulges or lesions. And I see none. No bulging or lesions appear. Then I'm gonna have to inspect the sacrococcygeal area right here for any signs of swelling, redness, dimpling, or hair. Alright, and I don't see any of it. The area is smooth and free of redness and hair. I will also inspect if there is a rectal prolapse, so I want you, sir, to do Valsalva maneuver again by trying to strain down or bathe. I will also inspect if there is a rectal prolapse, so I want you, sir, to do the Valsalva maneuver again by trying to strain or bear down. Alright, that's good, and I don't see any of it. Next, I'm gonna palpate your anus, and at this point, sir, I'm gonna perform an internal examination. It may feel like your bowels are going to move, but it will not, okay? So I'm gonna lubricate my gloved finger. And I want you, sir, to bear down, alright? So as the client bears down, I'm gonna place the pad of my finger on the anal opening and apply slight pressure because this will cause relaxation of the sphincter. And take note that you never use your fingertip because it causes the sphincter to tighten, and if you force it into the rectum, it may cause pain. And right now, I can feel the sphincter is relaxed. I'm gonna insert my finger gently with the pad facing down. And my finger enters the anus, so it's normal. And if severe pain prevents your entrance to the anus, do not force the examination. Okay, sir, can you tighten your external sphincter for me? Alright, good. So as he did that, you have to take note of the tone. So the client normally closed the sphincter around my glove finger, so that's good. And then after that, you have to rotate your finger to examine the muscular anal ring and palpate for tenderness, nodules, and hardness. And I feel none. Next, I'm going to palpate the rectum. I'm gonna insert my finger further into the rectum as far as possible. Then I'm gonna turn my hand clockwise and then counterclockwise because this allows palpation of as much rectal surface as possible. And you have to take note if there is tenderness, irregularities, nodules, and hardness. Alright, and I feel none. I'm also palpating for the peritoneal cavity, and this area may be palpated in men above the prostate gland in the area of the seminal vesicles on the anterior surface of the rectum. And I'm feeling for any tenderness or nodules. And I feel none. This area is normally smooth and untender. Then I'm gonna also have to palpate the prostate gland. And to do that, I'm gonna have to fully counterclockwise my hand so that the pad of my index finger faces towards the client umbilicus. You may also need to move your body away from the client to achieve the proper angle for examination. Then you're gonna tell the client that they may feel an urge to urinate, but they will not. Then you're gonna move the pad of your finger over the prostate gland, trying to feel the sulcus between the lateral lobes. The prostate is normally non-tender and rubbery, and the lobes are normally smooth and heart-shaped. Then lastly, I'm gonna inspect the tool, and to do that, I'm gonna withdraw my glove finger and inspect any fecal matter on my glove. And I'm gonna assess its color and test the feces for occult blood and provide the client with a towel to wipe the anorectal area. The stool should be normally semi-solid, brown, and free of blood. So that's all for the assessment, sir. Thank you so much for your cooperation and have a nice day. So I will ask my patient to change his patient gown into his clothes, and I'll be performing proper hand hygiene. Also, if there are any signs of abnormalities, we want to refer them to other healthcare provider for further evaluation. After that, we are now done with the assessment.